So from your experience, what do you wish more doctors, physical therapists, and even lawyers working in injury cases understood about the true potential of acupuncture in modern injury care?
Yeah. So, one of the most important things that we have to understand with acupuncture is it's not just the needling itself, but it's the practitioner providing the modality and understanding that if we can help the patient's nervous system find a level of safety, okay? And when we say safety, it gives them a little bit of a space for the nervous system to see its capacity to heal. We're going to start to empower our patients more. We're going to give them that sense of self-agency. And when you have a patient that has a sense of, I can do it, you're going to have a stronger effect. You're going to have a patient that's going to follow the directions of their doctor, their attorney, what's required of them. And what acupuncture does is it really allows that to happen. And I'm going to say to that same point, when we think about acupuncture, we want to be thinking about the human experience. And I think that's the biggest thing that's missed in these, you know, pay, you know, injury care and multidisciplinary approach. We're looking at all the parts of the body, but there's a human experience side that we have to keep coming back to. And if the community at large, in addition to the medical community, can understand that acupuncture affects multiple systems at once, it affects the brain and the body, it affects the patient's mood and emotional state through serotonin levels. It helps reset the autonomic nervous system so that you're in a calm, regulated state. It primes the body. I'm going to say the biggest thing with acupuncture is if the community can see acupuncture as a central hub of optimization for all modalities, you're going to see better results across the board. And the human experience is not ignored so that the patient feels that they're part of the process, because the patient has to realize there's nothing in the needle. And any change that occurs, it's their own resources. So when you have a patient start to make that connection, you have a bigger change across the board, because they become the center of integrative care, which is the core of what we teach our patients, that they are the center. No matter what I tell them, whatever I provide to them, if they don't listen to their own body, then they lose their power.
Yeah. So what you're saying is the magic isn't in the needle; it's in the person's response to the needle. And the analogy that I had in my head is, you know, a dumbbell doesn't grow muscle, right? It's
Yes.
the response. It's the response to the stress
Well said.
of
Well
your
said.
of your body that helps build strength and muscle. Um, yeah, I mean, I'm all for empowering people when it comes to their own health, rather than them relying on someone for their health. And I don't want to go down the whole rabbit hole, but it didn't go too well for a lot of people over the last 5 or 6 years. But that's a whole
It's a
nother episode.
whole nother, another episode. And at the same time, we do need to have that co-regulation. We need to have that capacity to, just like the failure to thrive for an infant, it needs the mother. We're all babies, as we're still humans, right? And humans were wired to connect. So any patient that walks into our center, immediately first thought is there's some type of dysregulation, there's some type of maladaptation, there's some type of lack of self-regulation. That's like the premise when people come in. So they need co-regulation. They need some type of connection, and connection is medicine. There's been so much research out there on that if we don't really optimize that, we're not really going to get the best results. So I know that, my doctors know that, my team understands that. So when a patient walks into the center, everyone knows your name. They feel safe. They feel connected. They're walking in smiling into our rooms because the administrative team is already priming the patient to be in a state to receive treatment. And we don't see that enough in the medical system. And it's my hope that we become an example for other medical groups and the medical system at large, start to realize that biopsychosocial model, which is now slowly, like a snail, but it's slowly entering the world of medicine, which is what Chinese medicine has been about. We call mind-body medicine for, 2,000 years. So I'm excited about the direction it's going. And I'm excited that I'm part of it as well.
Thanks for watching this video, and don't forget to like and subscribe to the channel.